Which imaging scan is best for lymphoma? Imagine trying to find a tiny needle in a huge haystack. That's what doctors face when trying to locate lymphoma inside the body. The most effective tool for this job is the PET scan combined with a CORT scan, known as the PET CORT scan. This powerful combination helps doctors see both where the disease is and how active it is. PET scans detect areas with high metabolic activity, which is typical of cancer cells, while CORT scans give detailed pictures of the body's internal structures. Together, they provide a clear map of the lymphoma's location and spread. The PET CORT scan is considered the most accurate for staging and restaging lymphoma. It can identify involved lymph nodes and even small areas outside the lymphatic system, called extranodal sites. This high sensitivity helps doctors determine the extent of the disease, guiding treatment choices, and monitoring how well therapy is working. It also helps detect if the lymphoma comes back after treatment. While PET CORT is the gold standard, it does involve some radiation exposure because of the radioactive tracer injected into the body, usually a substance called fluorodeoxyglucose, or FDG. The scan takes longer because of the waiting period after injection, but the detailed information it provides makes it worth the extra time. CORT scans alone are also useful, especially for detecting enlarged lymph nodes and pinpointing their size and location. However, CORT scans are less specific than PET CORT because they cannot distinguish between active cancer and scar tissue or inflammation. They are often used together with PET scans to improve accuracy. Magnetic resonance imaging, or MRI, is another option. Unlike PET and CORT, MRI does not use radiation. It provides detailed images of soft tissues and can be especially helpful for patients who need repeated scans, like young adults or children. Whole-body MRI, particularly diffusion-weighted MRI, has shown promise in detecting lymphoma and might be as effective as PET CORT in some cases. However, MRI can sometimes produce false positives because reactive or inflamed lymph nodes may look similar to cancer. Chest X-rays are sometimes used initially to look for enlarged lymph nodes in the chest, but they are less detailed and sensitive compared to CORT or PET scans. They are not usually enough on their own for a complete lymphoma diagnosis or staging. In summary, PET CORT scans are generally considered the best choice for detecting and managing lymphoma because they combine metabolic and anatomical information, providing a comprehensive picture. CORT scans are helpful as an adjunct, especially for detailed structural views. MRI offers a radiation-free alternative that is gaining ground, especially for follow-up imaging or in patients where radiation exposure is a concern. Always remember that imaging results are just one part of the diagnosis. They should be interpreted alongside biopsy results and clinical findings by healthcare professionals. If you or someone you know is facing lymphoma, consult with a medical team to determine the most appropriate imaging approach based on individual circumstances.